Hello everyone, my name is Juliana Holcomb, and I will be co-presenting this video abstract with my colleagues from Massachusetts General Hospital, Anamika Dutta and Talia Benheim. Suicide is the second leading cause of death among 10 to 24-year-olds and is associated with various psychosocial symptoms. This public health crisis is complex, however, due to the challenges in judging its severity, the dynamic nature of suicidality, and the weak predictive validity of suicidal ideation or SI screening. Thus, it is difficult, if not impossible, to predict which adolescents experiencing SI will go on to attempt or die by suicide. Our paper argues that a positive SI screen is relevant to clinical care, not only in the attempt to predict or prevent a patient from imminently dying by suicide, but also to invoke a deeper understanding of overall psychosocial functioning to target interventions. The study is the first that we know of to present data from a large sample of adolescent outpatients who completed the PHQ-9 modified for teenagers, the PHQ-9M, and whose parents completed the Pediatric Symptom Checklist 17-item parent report, or the PSC 17P, to identify the psychosocial functioning and risk of patients reporting SI.
In our study, data were collected through the Comprehensive Health and Decision Information System, or CHADIS, which is a well-used web-based platform that collects and scores patient-generated health data. The sample included 5,411 adolescents ages 11 to 17.9. Question 9 on the PHQ-9M measured SI by asking about thoughts that you would be better off dead or thoughts of hurting yourself in some way in the past 2 weeks. Overall, about 5% of youth screened positive on question 9. Females were over twice as likely as males to report SI, and older adolescents were significantly more likely to report SI than younger adolescents. Youth with SI were more likely to be at risk on the PHQ-9M beyond the increase explained by question 9 alone, and they were also more likely to be at risk on the overall internalizing, externalizing, and attention subscales of the PSC. As the frequency of SI increased, the mean scores on the PHQ-9M, the PSC overall scale, and the PSC subscales tended to increase in a stepwise fashion.
This study found that the PSC 17P and PHQ-9M screeners identified distinct and overlapping groups of adolescents with SI, who have psychosocial impairment in multiple domains that is relevant to pediatric primary care. Although our study cannot predict which patient will attempt or die by suicide, our data have implications for targeted psychosocial interventions for youth with SI. We found that youth who reported SI had significantly more internalizing, externalizing, and attention symptoms, overall psychosocial difficulty, and more depression. The diversity of problems grew as the frequency of SI increased. We suggest that suicidal ideation might be a chronic stressor that can result in a myriad of psychosocial symptoms in adolescents. We hope that the limitations in our study, including its cross-sectional design, the lack of usable data on important sociodemographic factors such as sexual orientation or gender identity, and unaccounted for provider and practice level differences in screening and its timing, will be addressed in future studies. Similar to patients with a chronic medical condition, such as diabetes or asthma, we argue that patients with SI should receive attention from the pediatrician on a regular basis, with co-management by a specialist as indicated. We applaud clinicians in screening for SI and depression in adolescents, but want to emphasize that it is extraordinarily difficult to prevent suicide. However, our results offer options to support and treat these affected youth in their specific psychosocial needs. Routine screening and follow-ups are a major way of achieving this goal. Pediatricians have many options to support youth with SI. Building a trusting relationship, reinforcing positive changes, assessing progress, managing medication, modifying the treatment plan at home and at school, supporting parents, and asking for second opinions are all pediatric responsibilities in chronic condition management. We are grateful to JDBP for the opportunity to publish as well as share our research with you. If you have any questions, please feel free to email Dr. J. Michael Murphy, the corresponding author on this paper. Thank you.